Okay. Okay, so we are evidence-based practice group 4. We are going to be talking to you about childhood obesity, promoting healthy habits through early childhood. My name is Lauren McCabe. So I'm going to go ahead and start. So the abstract of our presentation, predominantly obesity has been a concern with higher income countries, especially the urban middle class and higher middle class. But new evidence has suggested that these are changing and that low and middle class groups are having an increased prevalence of children who are overweight, which then develops into childhood obesity. So unfortunately, this burden has affected the lower socioeconomic groups disproportionately. Why this is significant for our world. So in 2017, of the 638 million school-age children globally, a total of 131 million of those are affected by being overweight, which comes out to 20.6% of children worldwide. According to Healthy People 2030, obesity, we all know the factors that increase when you are obese. A variety of health conditions, diabetes, high blood pressure, elevated cholesterol, as well as mental health issues, including anxiety and depression. Children from lower income families face higher rates of obesity compared to higher income due to these social and environmental factors that they have limited access to healthy foods and physical activity opportunities. So, because of all of this, our PICO question: in children age 6 to 12 with obesity, how does a combined program of nutrition education and physical activity compared to compared to no intervention of physical activity alone affect BMI and healthy eating habits over 6 months?
Hello, my name is Jennifer Smith. I'm going to go over the next two sections. The first one is barriers to implementation. Barriers to reducing child obesity through diet and physical activity include socioeconomic challenges, family and cultural habits, physiological influences, and environmental limitations and medical conditions. Many families struggle with the cost and accessibility of healthy food, while busy lifestyles and cultural norms often reinforce unhealthy eating patterns. Limited spaces in the community, schools, or parks for physical activity also contribute to the issue. These barriers can lead to long-term health problems such as diabetes, heart disease, and low self-esteem in children if a child became overweight or obese. Addressing these challenges through education, policy changes, community support, and parental involvement can promote healthier lifestyles, improving both physical and mental well-being for future generations. For our review of the literature, the search terms that we used were school-age children, obesity, physical activity, and nutritional education. Inclusion criteria that we used for our review of literature is selection was that it was focused on school-age children with obesity and had the intervention of physical activity and nutritional education. Exclusion criteria was if the child were or the children were not school aged and if the research article did not have both physical activity and nutritional education as the interventions. Total articles selected were 10 articles were chosen based on the results. What a physical activity program and nutrition education can do to reduce the incidence of overweight and obesity in school aged children.
Looking at the analysis of all the literature and um, all the reviews and studies we had looked at, childhood obesity remains a pressing public health concern with lasting physical, psychological, and socioeconomic impacts. This evidence-based project explores the effectiveness of combining nutrition education with physical activity interventions in children's age 6 to 12 compared to physical activity alone or no intervention at all. Review of randomized controlled trials in support of non-research literature consistently demonstrated that multi-component school-based interventions significantly improved BMI classification, reduced waist circumference, and encouraged healthier dietary habits. Some studies found no synergistic effect between combined approaches. Both nutrition and physical activity interventions showed positive independent outcomes. Findings support early implementation of structured, family-inclusive programs within schools and communities. Implications for practice include prioritizing preventative care through nurse-led education, advocating for school wellness policies, and engaging families in lifestyle changes. Future initiatives should incorporate long-term follow-up and larger, diverse populations to solidify best practices for reducing pediatric obesity and improving children's overall health outcome.
Hello, my name is Graciela Narvaez. Some of the literature review outcomes, evidence-based solutions. Studies constantly support the notion that behavioral modifications through structured interventions are more effective than singular approaches such as physical activity alone. Implementation of structured school-based interventions that integrated nutrition education and physical activity programs to reduce obesity rates in children. Support policy-driven initiatives that promote access to nutritious foods, expand physical education requirements, and incorporate routine BMI monitoring. Prioritize early, sustained interventions targeting undeserved and high-risk populations to reduce health disparities and improve long-term obesity prevention efforts. The Johns Hopkins Nursing Evidence-Based Practice Model was a three-step approach to research by developing the Peacock question, performing literature search of credible articles, and finally developing evidence-based suggestions. This tool was used to
Hey guys, I lost her.
That's okay. So this tool, the Johns Hopkins Nursing, was used to determine the importance of the combined nutritional education and physical activity among the school-aged children when we did our research.
Okay. This is Naveen Fanous, and the last part, dissemination and evaluation. Clinical and community-based nurses, school health professionals, and pediatric providers should integrate structured, age-appropriate nutrition and physical activity education into routine care of children aged from 6 to 12. Use the clinical visits to educate parents on the importance of healthy lifestyle and how it can affect the child's health. Refer children with obesity to community programs and multidisciplinary team, including a dietitian and physical activity specialist. Healthcare and community outreach in various settings, such as sharing results with the school nurses, pediatric clinics, and public health departments to support adoption of school-based nutrition and physical activity programs, host informational session or webinars for parents, educator, and community leaders. And the final piece of our education material is the picture here, and we developed this photo to just integrate with all the information. Thank you. So should I stopped?
It's still recording.